Do you have problems with lower back pain, sciatic nerves, everything like that? You know, kind of runs down through your lower back, down into your legs. Well, the best thing to do is come see Dr. Sonia Spencer at Spencer Chiropractic here on Pass Road in Gulfport, right across from Pass Road Elementary. Dr. Spencer, it's always a pleasure to see you.
Good to see you too, Jim.
There's, I don't know, more and more people, and we've been talked about so many different things, but you see a lot of people that suffer from lower back pain, and it just kind of all melds into one. It goes into that sciatica on that one side there and down into the leg, and there's a kind of a correlation between all three of them. And sometimes about the only thing that you can do is come see you to get relief.
Right, and lower back pain is the most frequent reason that someone would come into my office. Lower back pain occurs with and without sciatic nerve pain, and sometimes people get sciatic nerve pain with no lower back pain at all, so it can be confusing to people. But all of those things respond great to chiropractic care. And one of the first things we do, of course, is sit down to someone and talk to them about their history before we begin any treatment on them. We see several people who have had failed lower back surgeries who are still having lower back and sciatic nerve pain, and we work with some of the neurosurgeons in our area who refer us in cases who haven't responded to surgery. And that's one way that we get patients, but you can also just come in off the street if you're having these problems before you go see a surgeon. Because one of the most frequent causes of the lower back pain and sciatic nerve pain is a disc problem, okay? Disc problems are very, very common in today's world. When you hear the word bulging disc, you know, just about everybody's got one, right?
Yeah.
And it's true. You know, they did a study on MRI a few years ago and took 100 people that did not have lower back pain at all. And over 30% of them had a bulging disc.
Really?
Yes. So it's a very, very common finding, even with people who don't have lower back pain. But what we have to correlate is that bulging disc or is that disc problem actually part of what's causing your pain? Because if it's not, that may be why you were a failed surgery case, and if something else may be going on that could have been causing your problem in the first place. So it's kind of like becoming a private investigator when we see a patient, finding out what's causing the lower back pain and doing our best to correct it.
And that's one of the things too is, sitting down and talking to them, okay, what kind of lifestyle do you have? What do you do every day? Are you sitting down every day and hardly getting up? Because, I mean, they tell you that if you're sitting at a desk every day, every now and then you should get up and move around, because if you don't, that is going to cause you some back problems along, down the line.
That's correct, Jim. You know, they're calling sitting the new smoking now. It's so detrimental for your health, yes. So if you do have a desk job, or if you are sitting, truck drivers, whatever, you need to get up and move at least once an hour. So let me talk to you about some of the causes of the lower back and sciatic pain and show you how that works, okay? We have these joints in our back, and the joints of the lower back are gliding joints, and they should move just like this.
Right.
Okay, and sometimes due to abnormal pressure or misalignment, the joint will lock up and not move at all. In chiropractic, we call this a subluxation, when the joint does not move. And as a result of that, some swelling can occur, and that swelling can start putting pressure on some nerves. Now, there's all kinds of nerves around here. There's nerves at this joint, there's nerves coming out between the joint. Our nerve system is everywhere in our body. But if a joint does not move well enough over a period of time, what happens is this disc here will start to degenerate. Just as if you had a broken arm and someone put a cast on your arm because you weren't moving it and things start to shrink up, the same thing happens with the disc. If the joint is not moving, the disc will begin to shrink. So there becomes less room for the nerve to move about in a pain-free fashion. So we check to see, is the joint moving well? Is there motion? And most of the time in patients, their joints are not moving well. So as a chiropractor, what we want to do is restore normal joint motion here, and patients feel this. They start to get body signals. I'm stiff. It hurts to go from sit to stand. I have problems getting out of my chair. I don't move like I used to. And what they say to themselves is, I'm getting old, right? You hear
I
that
try
a lot?
not to say that. I try.
Well, I hear it all the time from people younger than me. I'm getting old, and I have to correct them. You know, there's not really such a thing as old age spine. There's such a thing as I haven't taken care of my spine. That I've been abusive to my spine. And your spine is just like your teeth. If you don't take care of it and do some maintenance on it and so on and so forth, you're going to have some problems. So the better we can keep these joints moving, the less likely you are to have back problems. And once we find that joints aren't moving well, if we can get them moving in unison, the less back problems you're going to have. So let's talk about that sciatic nerve.
Okay.
All right? The sciatic nerve is formed from the lower nerves that come out of your back.
Right.
In this lower section down here, and some of them that come through your sacrum area. And they come together and form the largest nerve in your body. And that nerve comes together and comes into your buttock and goes all the way down into your leg there. And this nerve pain can be very excruciating. But that nerve starts from the nerves that come through your lower back. So we have to look to see if the beginning cause is right here, if you have some muscles that are over tightened, putting pressure on the sciatic nerve there, if the pelvis is misaligned and causing the buttocks to over tighten. That is a frequent thing I see in failed surgery cases. The pelvis being twisted or rotated and locked in a position that's putting pressure on that sciatic nerve, and the patient had a disc surgery, and the problem did not go away because they have some pelvic rotation. We adjust the pelvic rotation and the patient gets better. So many causes for this. That can cause pain out into the buttocks and, of course, inflame that sciatic nerve. The further down the leg it is, it can cause numbness and tingling down into the toes and so forth. Many times patients lose feeling, sensation into their legs, and we have to check all that too. Make sure their muscle strength is good, their reflexes and so forth. This helps us treat the patient.
All right. Thank you so much. Some more great information. If you're having some problems with your lower back, that sciatic nerve, I know a lot of people do because a lot of it depends on what kind of lifestyle that you have. If you're sitting, driving all the time or whatever, call Dr. Sonia Spencer. The number is on your screen. You can call and set up an appointment. She's located on Pass Road in Gulfport, right across the street from Pass Road Elementary. And get yourself some relief. I mean, it's an easy thing to do. It may take a few treatments, but hey, in the long run, you're going to feel a whole lot better and you won't have that pain in the you-know-what. Call Dr. Spencer.